It's divided into posterior, anterior, lateral, and medial compartments. الانتيريور have no ligaments والposterior have no ligaments. الليجامنتس هي دائما على lateral والmedial compartment. I will talk first about the ankle ligament. It's divided into lateral collateral ligament, syndesmotic complex, interosseous ligament, and medial collateral ligament. At first, the lateral collateral ligament, it consists of anterior talofibular, الفيبولا وهذا التالس. At first consists of anterior talofibular وposterior talofibular والcalcaneum fibular، بالإضافة إلى الليجمنت of syndesmosis اللي هي الانتيريور inferior tibiofibular والposterior inferior tibiofibular. هاي البيكتور أحسن توضح لنا السندسموسيس اللي هو fibrous connection between two bone مثل الراديوس والألنا التيبيو والفيبولا consist of the anterior tibiofibular ligament والposterior inferior tibiofibular بالإضافة إلى الانتروسيوس membrane، بس هذا شوي الليفل مالته أعلى من الأنكل joint. So فمعناته الانتيريور tibiofibular والposterior tibiofibular, it's part of the lateral collateral ligament. This is an axial section MRI, show the anterior talofibular ligament, which is hypointense in all sequences. This coronal section show both the anterior tibiofibular, which is part of syndesmosis, and the anterior talofibular ligament. This is injury in the anterior talofibular ligament. We see the ligament is absent and there is a focal expansion of the joint space with joint fusion. This is an ultrasound of the anterior talofibular ligament. This is normal ultrasound, and this is patient with the chronic tear that presented with the increased thickness of the tendon and increased vascularity with the scanty joint fusion. In this section, we see both the posterior talofibular and the anterior talofibular ligament. As we see, extend from the fibula to the talus. وإحنا نشوف هنا الفيبولا ما نشوف التيبيا، لأن التيبيا تخلص قبل الفيبولا. This is coronal section that show the calcaneofibular. مثل ما قلنا هي part من lateral collateral ligament. This is posterior للبيكتور، نشوف بها الposterior tibiofibular part of syndesmosis والposterior talofibular ligament. Also, these pictures show the anterior talofibular, anterior tibiofibular والanterior talofibular. This is show posterior tibiofibular and posterior talofibular. Radiology here, injury syndesmosis usually involve rupture of the anterior tibiofibular ligament لأنه posterior tibiofibular يكون stronger. فإذا صار به injury عادة associated with avulsion fracture rather than soft tissue rupture. Now talk about medial collateral ligament, which is called the deltoid ligament. It's a triangular ligament that divided into superficial and deep parts. A superficial consists of طبعا أول شيء هو connect ما بين التيبيا التالس navicular and the calcaneum. أول شيء التibio navicular ligament, tibio spring ligament that have two ends to attachment to the sustentaculum tali of the calcaneum and the navicular tuberosity. والتibio calcaneal ligament superficial posterior tibio-talar ligament. هذين كلهن superficial part. الدي part مالته هو الدي posterior tibio-talar والانتيريور tibio-talar مثل ما مقسميناه شفناه بالبيكتور. On MRI. This is a coronal section that shows the deep deltoid and superficial deltoid ligament. طبعا superficial نشوفها لازم in multiple oblique planes، بينما الديب ممكن نشوفها in direct coronal image. This is also coronal section that show the superficial deltoid, and this is the spring ligament. This is also spring ligament, which is part of superficial deltoid ligament. This is an important picture that shows both the lateral collateral ligament, part of lateral collateral ligament, and part of medial collateral ligament. هنا الانتيريور تيلوفيبولار والبوستيريور تيلوفيبولار، وهنا راح نشوف السوبرفيشال والديب deltoid ligament. الانجري للميديال collateral ligament accompanied complex ankle trauma and invariably associated with disruption of lateral collateral والsyndesmotic ligament. The ligament of sinus tertii. طبعا sinus tertii هي cone shaped space between the inferolateral malleolus والsuperolateral of calcaneus. عادة هي filled with fat in healthy patients. Maintains stability by two ligaments اللي هي interosseous ligament and cervical ligament. The sinus tertii syndrome هو pain or injury in this area due to traumatic injury or overuse due to walking or repetitive standing. It's a primary instability of subtalar joint due to ligamentous injury that results in synovitis and infiltration of fibrotic tissues into sinus tertii space. Because the sinus tertii is richly vascularized, so rupture of ligamentous readily heal without surgical intervention. Although scarring and persistent laxity may result in long-term instability. This is an on MRI T1 that نشوف احنا normally الفات bright من صار اكو عندنا trauma infiltrated with edema صارت low intensity left side. Now we'll talk about tendons of the ankle joint. At first, we'll talk about Achilles tendon, which is the strongest tendon in the body that formed by merging of gastrocnemius and the soleus tendon and extend inferiorly to insert in the dorsal margin of the calcaneus. The tendon to Achilles is well visualized on both ultrasound and MRI in sagittal plane. This is sagittal MRI show the Achilles tendon that insert in the dorsum of the calcaneus. This is an axial section that show this is the Achilles, which is usually either concave or flat. If it's convex, so it is abnormal. This is an ultrasound of Achilles tendon. A and C is normal ultrasound feature, and B and C show abnormal Achilles tendon with the enthesopathy presented with increased thickness, calcification, and bursitis. This picture is heterogeneous, hypoechoic, and increased thickness. Achilles tendon injury occur either at the insertion of the Achilles tendon, association with retrocalcaneal synovitis and bursitis, or at the musculotendinous junction, which is 6 cm proximal to the insertion on the calcaneus, where the tendon fibers intertwine to create a zone of relative ischemia. This is normal Achilles tendon, and this presented with bright fluid due to injury to the Achilles tendon. Now I will talk about peroneal tendon. The peroneal muscle base within the lateral compartment of the leg that give rise to the peroneus brevis anterior, high peroneus brevis, and peroneus longus. اللي هي coursing around the lateral malleoli. إذن هي على lateral side. Around the lateral malleoli تجي على lateral side. The brevis insert at the base of the fifth metatarsal, وال longest pass behind the cuboid and insert to third metatarsal and medial cuneiform. This picture show the loss pass behind the cuboid and insert in the first metatarsal and middle cuneiform. This is an MRI sagittal view that show this is the lateral malleoli, and this the peroneus brevis anteriorly, and this is longus. And this is also axial section posterior to the lateral malleoli. It's responsible for plantar flexion and eversion and maintained by peroneal retinaculum. Radiology view. طبعا التروما عادة تكون بالبريفس أكثر من البيرونيوس longus. And as we see, this is longitudinal tear in the peroneus brevis. In this picture, this is a trauma to the peroneus longus, where this fluid is seen along its site of origin and is seen dislocated of the tendon from its normal site, while the peroneus brevis tendon in normal position. Now we'll talk about posterior flexor tendon. The posterior flexor tendon include tibialis posterior, flexor hallucis longus, flexor digitorum. طبعا هاي شنو تكون posterior medially. بس احنا اخذنا laterally هي البيرونيال وهاي تكون posterior medially. consists of أول شيء هي tibialis posterior، بعدين الفلكسر digitorum longus، وآخر شيء هي الفلكسر hallucis longus. Tibialis posterior هي the most commonly injured tendon, one of the most commonly injured tendon in the foot. The tendon has continuation of the muscle belly within the deep posterior compartment of the calf around the medial malleoli, pass around the medial malleoli, and insert the base of the navicular and have a multiple insertion in the forefoot at the base of cuneiforms and base of the metatarsal in second to fourth. Tibialis posterior tendon provide major support to the medial and longitudinal arch during the planted foot phase of the gait cycle, responsible for plantiflexion and inversion of the foot. This is also MRI. This is on sagittal that shows the tibialis posterior, which pass behind the medial malleoli. And this is the tibialis, also tibialis tendon or tibialis posterior. The flexor hallucis longus, which is part of the posterior compartment, flexor compartment, responsible for flexor and inverter of the foot, inserted at the base of the distal phalanx of grade 2, runs in the fibro-osseous tunnel along the posterior aspect of the talus, which may be the site of a friction that leading to tear in palate dancer, accentuated by the accessory ostrigonum. Now I will talk about anterior extensor tendon. The anterior extensor tendon consists of the tibialis anterior, extensor digitorum longus, extensor hallucis longus tendon. They act collectively, they act as dorsiflexion and invert the foot at the ankle joint. The extensor digitorum and extensor hallucis also extend the toes. This is a picture that shows. This is the anterior compartment, consists of tibialis anterior, extensor hallucis longus, extensor digitorum, and dorsalis pedis runs anteriorly of the ankle joint. Tibialis anterior tendon in the anterior compartment of the calf, giving rise to the tendon at the level of tibiotalar articulation, then pass deep to the extensor retinaculum, insert into medial cuneiform and medial base of first metatarsal. It is dominant flexor and inverter of the foot. This is sagittal plane that show the tibialis anterior and the extensor hallucis longus. This picture is very important that show an anterior extensor compartment, اللي هي tibialis anterior, extensor hallucis, then extensor digitorum. And the posterior flexor اللي هي tibialis posterior, and here at first come the flexor digitorum, then flexor hallucis longus. And laterally we show the peroneal tendon اللي هي أول شيء البريفس وبعدين البيرونيال longus. This is picture show the retinaculum, which is the fascia band that support the tendon in their position. عندنا أول شيء extensor retinaculum هي superior و inferior. عندنا inferior peroneal و superior peroneal وعندنا flexor retinaculum. Finally, I will talk about subtalar joint. It's synovial joint responsible for inversion and eversion of the foot. Involve three subtalar facets. اللي هي أول شيء posterior facet وهي الcalcanea والmiddle والanterior, which is all for the talocalcaneonavicular joint. The subtalar joint is seen by plain X-ray, CT, and MRI. This is an oblique view with internal rotation 45 degree and angulation about 30 degree. This visualization clearly the joint space. This is an CT scan shows subtalar joint space. And this is an MRI shows the subtalar joint. And thank you for your listening.
شكرا جزيلا دكتورة تمارا.
نعم أستاذ، navicular bone.
navicular bone. اوكي. فرح.
نعم أستاذ، بتالر دوم، تالر بون دوم.
اوكي. دكتور مرتضى.
نعم أستاذ، السي السبتيلر جوينت.
اوكي. سؤدد.
نعم أستاذ، الدي كالكينيوس بون.
كالكينيا. اوكي. ورا سؤدد رغد.
نعم أستاذ، الإي كيوبويد بون.
بالضبط. اوكي. استاذ محمد.
اي نعم وياكم عندي. محمد حسن. اي محمد حسن موجود. محمد خضير. موجود محمد خضير. مروان.
استاذ تيبيالس انتيريور تندن.
نعم. هدى.
نعم أستاذ، البي extensor hallucis longus tendon.
نعم. هديل.
عموسي فليكسر هاليساس لونجاس تندون.
شيماء مجيد.
نعم أستاذ، فليكسر ديجيتال لونجاس تندون.
زينب هاتف.
نعم أستاذ، اللي هي تيبيالس بوستيريور تندون.
اوكي. عاشتي دكتورة سما.